Good afternoon, ASOHNS attendees. On behalf of RMIT University, Westmead ENT, and LEAP Australia, I would like to present my work on new computational methods for predictive endoscopic nasal surgery. As the project is still currently in development, I'll discuss preliminary findings for the applied computational techniques and possibilities for clinical adoption. The current project is designed to evaluate computational tools that may be beneficial for pre-surgical planning and enhance patient point of care by providing rapid insight into the fluid flow characteristics in a virtual environment. Patient-specific models will be generated directly from computed tomography using the 3D slicer software. This is achieved by layering CT images and highlighting specific regions of the nasal anatomy. Minimal modification of the geometry is required and can be completed using the mesh mixer software. Following modification, the geometry can be subjected to an automated computational fluid dynamic analysis workflow to gain insight into the fluid flow characteristics and reveal locations of flow restriction. Finally, a predictive geometry can be optimized using the ANSYS adjoint solver tool based on stated objectives. Problem-specific objectives can be determined during the initial CFD characterization. These may include the goal of reducing pressure drop between 2 points or generating uniform velocity about a specific plane. As meshing, simulation, and optimization are all located within the ANSYS Fluent interface, the process can be scripted to significantly reduce the computational time and required hands-on labor. Following geometry construction and modification using the 3D slicer and mesh mixer software, the fluid flow can be simulated in ANSYS Fluent. The current simulation was performed under steady-state conditions to represent an instantaneous inspiration event. To gain further understanding of the fluid flow and turbulence phenomena in respect to time, the simulation can be reiterated under transient conditions. However, this will require a significant increase in computational resource and therefore would not be suitable for point-of-care applications. The planes above, taken from a CFD analysis of a nasal geometry with septal deviation, clearly display regions of fluid restriction. The top planes indicate static pressure. As observed, there is a clear narrowing on the right-hand side of the septum associated with increased pressure. The planes below display the inverse relationship, with decreased velocity about the right-hand side due to the fluid flow restriction. Following initial simulation, the models were subjected to an ANSYS adjoint workflow in an attempt to modify the geometry based on stated objectives. Adjoint optimization methods use a linearization approach to reduce computational cost of gradient-based optimization methods. This significantly reduces the computational load, leading to a substantially reduced simulation time. I'd like to present an overview of the adjoint optimization workflow. CAD is generated through CT imagery of the patient's nasal passage and meshed using the ANSYS Fluent meshing software. An initial flow simulation is then computed under a steady-state or transient configuration. Once the initial simulation is completed, the adjoint design observables must be created. In the present case, a single objective is selected to reduce pressure drop across the system. The adjoint sensitivities are then calculated for the applied observable conditions, giving insight into regions of the geometry most susceptible to modification. The mesh can then be modified in a single iteration or automated to complete numerous iterations. If the morph mesh achieves the desired outcome, it can be exported. If not, it can be further iterated until it achieves the required goal. The geometry was simulated without the frontal or maxillary sinuses to reduce computational complexity. These regions will be reattached when a suitable modification is achieved. The optimization was run to reduce the pressure drop across the right-hand side of the nasal airway. As shown in the above cross-sectional planes, the pressure drop was reduced substantially. However, minimal geometry reduction was required to achieve this, highlighting that pressure drop may not be a suitable observable for optimization. Slight modification of the left-hand side geometry was also observed, indicating the tool is not completely adhering to the design limitations. To address these issues, multiple observables will be employed at localized regions along the right septal regions, and the optimization will be reiterated. An automation workflow is currently in development to reduce the required hands-on time needed to complete the simulation. CAD development and modification is currently a manual process and requires experienced personnel to ensure accuracy. Consequently, this process requires significant time investment. As meshing, simulation, and optimization are within the same software package, this workflow has already been developed to satisfy the analyzed septal deviation model. However, further work is required to generalize the workflow for additional models. Original characterization methods provide a robust analysis of the fluid flow. however require experienced interpretation to verify regions that require modification. Although the adjoint simulation generates an optimized model, it is currently not adhering to surgical procedures. The final goal of the project is to generate a generalized workflow that can provide patients and clinicians rapid insight into the fluid flow behavior of the restrictive fluid flow, and offer prediction on services that should be modified to alleviate observed restrictions. Finally, I would like to acknowledge the team that currently helped me through this project. If you have any questions, please feel free to ask. Thank you for attending.